So what is pre-implantation genetic testing? Pre-implantation genetic testing means we are testing or rather screening the embryo for any sort of genetic abnormalities before we are transferring the embryo into a lady's womb. So when does pre-implantation genetic testing come into play is that there are couples who have already had a previous child who has genetic abnormalities, for example, Down syndrome, Klinefelter syndrome, etc. Or they may have had multiple miscarriages where we are not able to identify what is a specific reason. So we've screened the woman, we've screened the man, we've done genetic screening for both partners, and we've done IVF, and they've had multiple implantation failures where we've ruled out an embryo factor as well as an endometrial factor. So in these sort of scenarios where we have unexplained prolonged infertility, where a couple has already a child with genetic abnormalities, when one of the couple is a known carrier for a genetic abnormality and there is a chance that it can get passed on to the offspring. So in these sort of situations, pre-implantation genetic screening has a very big role, where pre-implantation genetic screening can be done for a couple where we specifically take a biopsy of the embryo, a day 5 embryo, and we screen the embryo for different types of genetic disorders, or we also are able to identify whether it is a genetically normal embryo or genetically abnormal embryo. That is pre-implantation genetic screening. There is another arm called pre-implantation genetic testing, M, where you're specifically screening for specific mosaicisms, where you know that there is a specific genetic disorder that you're screening for, which either could be in the couple or the previous child has a specific disorder, and when you're specifically screening the embryo for a disorder, it is called PGT-M. So there are many arms to pre-implantation genetic testing where you can do a complete screening of the embryo for any disorders that either was identified in one of the couples, or if they have a child with any known genetic disorder and they are worried that it may have been, there may be a chance of recurrence in the next child as well. So in these sort of situations, you can do a complete screening for genetic abnormalities, or you can do a screening of the embryo for any specific abnormality that we need to worry about. So how pre-implantation genetic testing is done is that the couple has to go through a regular IVF cycle where the woman is given gonadotrophins and then the egg retrieval is done, and then the husband's sperm is in either IVF is done or ICSI is done. And then the embryo that comes from that is then allowed to grow till day 5, and then in day 5 we specifically, a laser is used to take a biopsy of the embryo and a specific cell is taken, and then the lab screens the embryo for that specific cell for any genetic abnormalities that may be there in the embryo. So how many embryos can be biopsied? It depends on the couple. They can choose to get only a few biopsied, or they can choose to get all the embryos biopsied. It totally depends on them. If a couple is older, because as the woman's age increases above 35, the risk of abnormalities in the embryo increases purely from a maternal age point of view. So for an older woman, again, PGT has a big role because it helps us screen for any genetic abnormalities. It helps us differentiate between a genetically normal embryo and an abnormal embryo, and transfer thereby only a genetically normal embryo to help improve the couple's success.